external rotation drill. It is a test and a tool. You're going to turn over to the side. You're going to tuck your tail under so you know you got good kind of pelvic mechanics, that your tail is tucked under. It doesn't have this huge lumbar arch. So with your tail tucked under, your quads engaged, your ribs pulled down, then you're going to bring your elbow right in line with your shoulder. In fact, you may even want to kind of pinch grip your own delt. So what I mean is you find like this kind of hood of the anterior delt right where it comes up to the clavicle. And I'm going to try to push and floss that down. So again, I'm over to the side. My elbow is in line with my shoulder. I'm pinching into my anterior delt. And then from there, I let it drop. And at first, it's just a test. Elbow in line with the shoulder. How far can it drop? In theory, you want the hand to be right underneath it to 90 degrees. But as you can see, I don't even really get there. Anywhere between 70 and 90 degrees is ideal. But most of the time, especially for CrossFitters, we're not like, butterfly swimmers and spend a lot of time in internal rotation. We're not throwers and spend a lot of time in that position. So instead, we're going to see if we can't kind of help us out. So I'm here and I'm going to do that same drill. I'm going to resist and try to push into more internal rotation. Feel the kind of pull along the tricep, pull along the anterior delt, and relax. And then again, I'm going to engage for 5, 4, 3, 2, 1, and relax. And then I engage. I see if I can improve that range of motion. I might even grab on a little and help it out. I'm so close. My shoulder is not popped forward, but it's still pulling back. 2, 1, and relax. And then from there, bring the hand right to the small of the back and try to slide it all the way up. From there, it is our other test. Can the left hand try to grab on to that to the right fingertips? And you might find that because you just did that drill, that it ends up being a little bit easier. And then we'll do it on that other side. So you'll take the left hand, you'll bring it out, elbow in line with the shoulder. You might even try to push the delt down. You can also do this against a wall and kind of get an idea there how far away from a wall you are. But you want to make sure that you can still work on the drill. So I'm here, elbow is in line. I try to line it up for you to see. Boom, elbow is in line with the shoulder. My internal rotation is crap, especially on my left side. So I'm going to engage and see about pulling in through these muscles, kind of popping in through the back of that shoulder, and then relax. And then I engage, and relax. And I engage for 5, 4, 3, still pulling the shoulder back, 2, 1, and relax. All right, so we can thank your medial epicondylitis, which is just a fancy way of saying that you have some inflammation in and around the elbow tendons. The biggest reason why that we see it kind of in and around the elbow on this medial side is almost always because of lack of external rotation. It almost always is because, right now we are just about getting that barbell to rest on the shoulder. So we're finding the kind of external rotation sort of that we need in through the proximal area, so the side closest to us. We're getting it there, but unfortunately there's still kind of downstream some issues that we need to clear up before that elbow is going to feel like it's not compensating in one way or another. So we're going to start actually a little bit lower. We'll start from the distal and kind of move proximally up. You're going to try to find your trigger point right in through here. And it's in between these two bones, so you're just going to basically pinch grip it and then kind of line it back and around. Once I pinch grip it, I can kind of roll it up, back and around. You're just trying to floss your own tissues, get an idea of what clicks, what slides. And then you'll grab onto a knot out or one of the smaller knot outs. You want to feel like you can get in between that bone. So I'm just going to take it on one side. I'm going to floss it down here, and I'm just going to flex and point. Maybe a little side to side, definitely moving it up, back and around, up to the top of the wrist and then back, and try to find that spot, try to find that muscle where when you pinch on it, you automatically allow your fingers to bend and relax. So that's when you know that you've kind of hit a good spot, is when it just takes control of your extensor finger muscles and it can curl your fingers in. After that, you are going to move up to right above the elbow. So you're going to try to grab onto that bone of the elbow and then cup it upwards. So again, I'm here, here's the bottom of the elbow, and I'm cupped upwards. Hold on one sec. Kiki's crazy. I hold on right above it, and then from there, as I pinch grip right above that elbow bone, I'm going to kind of bring it back and forward again. I'm going side to side this way. Here's looking at you, kid. You're hanging out here, rolling around, but most importantly, that side to side action. I can kind of travel that up if I wanted to, but the area of most resistance is probably going to be right above that elbow, or I'm sorry, right below. So forearm side, not tricep side. After that, we're going to move up. You can try this stretch without any resistance or out any kind of distraction, and it's still a good one. So I'm here, and I'm going to find internal rotation as far as I can go. So I'm going to try to corkscrew into internal rotation. And if I pulse this a little, so as you can see my hands trying to find a little bit more internal rotation corkscrew, I can feel a little stretching through here. I might feel a little stretching through the back side of here. I might try to internally rotate more and maybe bring the hand to the small of my back. I might even try to grab onto it with my other hand and pull it down and corkscrew it a little bit more. So as you can see, I'm aiding in a little bit more rotation with that other hand. I like the added benefit of feeling like I'm pulling on my arm, and then I can play around with a few neck stretches. After all, it all is connected. And then once you get an idea of what the stretch is demanding of you without any resistance, then you're going to grab onto a resistance band. Where is it? Kiki's, where to go? I feel like you had it. Well, this is awkward. Oh, I found it. So you're going to step onto it. So here I am. I step onto it a ton because I'm not getting into a front rack position. You're just going to try to get right up behind the wrist. And then I'm going to sit up. So there's resistance kind of pulling my hand down, and I'm pulling my fingers back just like I would have to in a front rack. And then I'm going to internally rotate it and bring it back behind me and grab onto it. So if you're confused from the back side, it looks like this. I've taken it, I ease off any resistance that I need, internally rotate it, and then grab onto it. From there, I'm right in through here, and I'm going to try to push it down, internally rotate it more, try to pop that shoulder forward, pull the wrist back. And it's just a kind of nice counter stretch to what you're demanding of your shoulder all day long, which is that external rotation, flexion in through the elbow. And now we're trying to find internal rotation and extension of the elbow. So it's just a nice kind of way to counter things. After that, however, you will turn it into a front rack position. So you'll step onto the resistance band, you'll grab on, and then you'll bend the elbow as much as you need. Maybe you grab onto a less resistance than I do. And then you pull over to your side. Well, you think about pulling over to your side, in that you can tuck the tail, you can pull the ribs under, and then you can still get a little bit more tricep extension out of there. The important thing about the position is that my hand is up, my palm is up, so it does feel like a true front rack. And then I play around with kind of taking my arm and corkscrewing it over. So notice my hand just went to the outside, my elbow is as far up as it can possibly go. It's my headlights. And then if it feels too much on the elbow, you've gone too far. Maybe you're going to bring yourself back in through here and enjoy lengthening the tricep and let that happen first. Maybe laterally shift over, get in through there a little bit. And then once you feel like you're able, hold on to the elbow, pull it down, and bring the hand to the outside. Again, you can always bend this knee. You can always stamp it kind of onto a bench and play around with just as much or as little external rotation and flexion as you can. After that, we want to prep the idea of what external rotation is. So if we're missing external rotation and our elbow is being affected by it, then we're going to see if we can't kind of prep that position. Here I am. I grab onto it. And then all I'm going to do is I'm in internal rotation. And I even kind of enjoy this stretch in internal rotation. I might even pull away and enjoy it to its full potential, finding that extension through the back shoulder. And then what I want to find is a corkscrew. And then you're going to bring the elbow in and then let it go. and then protract it again, corkscrew it back. Bring yourself into elbow flexion, trying to get the hand to the outside, and you're using strength to see if you can't finagle yourself into this better front rack position. External rotation followed by flexion and control of that back rotator cuff. And then back. Let me know if you experience any pain in through the elbow. If you do, it's not worth it. Go down in resistance, and maybe you even just kind of feel what it's like pinky, like with a little resistance. I externally rotate it. I feel that corkscrew of the shoulder. I'm in a much better position on this left side than I am popped up in this right side. You can even tell here. So I'm here, and then I bring that elbow, and then maybe I just hang out there. I think about popping that elbow forward in that same drill that we just did. Hand pulls back, elbow pit forward. So you'll do about 10 drills on that side, 10 drills on the other side. A super, super wide grip, but your palms face forward, PVC pipe to the back. And then you'll bring it forward, forward, forward. Allow your shoulder blades to internally rotate. So that way you can work on trying to get as much into this internally rotated false grip as possible. This is your false grip. So this is a strengthening tool to get into a better false grip, as well as a nice little stretch for your extensor forearm muscles and a good counter to always pulling back. Now notice that I told you to roll your shoulders forward. That's so you can allow yourself to get in this position. Then I want you to pull your shoulder blades back and shoot your knuckles down. And when you shoot your knuckles down, I want you to let your head tilt over to the right, because it's a nice little stretch that you can't escape from. And then you'll come back in through to center. Again, recommit to shooting the knuckles down, especially on the right side, as you let the head tilt over to the left. Woo, that lights me up like a Christmas tree. And then you bring yourself back in through to center, chest bump the sky, maybe rock a little side to side. It's okay if you can only hold on a couple fingers. You're eventually working to be able to hold on to a false grip, just like how you eventually work to be able to really hold on to a false grip in the bottom of the muscle up, which, by the way, I know nothing about. Then you're going to bring yourself a little bit more narrow gripped. So in theory, you would interlace your fingers back behind you, but because we both know that that is not in your arsenal yet, then you'll bring yourself as narrow as you think you can in order to chest bump the sky, hinge at the hips, and then forward fold. When you forward fold, I want you to feel like you are shooting your knuckles straight up to the sky, and that you let your head drop really heavy. You can shift a little side to side, and then slowly bring it back to the small of your back, and then curl yourself up, vertebra by vertebra. Today we're going to try to zero in on lateral flexion, which is a fancy way of saying how much can your spine move over and to the sides. So another way of gauging thoracic extension, the ability for your spine to extend, we also look at the ability for the spine to rotate, and then we also want to know the ability for the spine to move side to side. So they all kind of contribute into the length and space that we're looking for out of the spinal erector muscles. So I'm going to try to go to the 12th rib, a place that we often start. And you'll bring your hands back behind you and then chest bump, kind of like this. And then try to peel your fingertips back and see if you can't lean back a little. You're going to try to find that same stretch on your anterior head as we kind of just rocked into. And then once you've kind of exhausted all that, maybe you've shifted over, you'll bring your hands behind your head. And then you'll start to lean over to the right. So we're going to focus on climbing up the right side of your spine. As I'm on to the right side, I'm going to think about digging into the right side, but leaning over to the left, which is horrible. It's a lot worse than even I am making it sound. It takes your breath away. You wrestle with that, and then you find a new spot. I slid down as to move up my spine. I'm still digging into the right side, and then I lean over to the left. Again, I'm still digging into the right side. So if I were to show you from this angle, I'm here. I'm here. I'm still leaned over to the right side. That's why you can see me. There's no part of my left lower back that's on it. And then I peel myself over to the right. I'm trying to laterally flex away, trying to open up the crevice in between my ribs. And I do that all the way up to my armpit. Once I get all the way up to my armpit, then you'll just hang out and find this anterior delt mash.